increased heat in HFE hemochromatosis. Definition: the deviation in heat from the reservoir population remaining stable over time did not correlate with the taking of HFE mutation body mass index iron ferritin levels. Liver enzyme elevation. Liver failures are clinical manifestations of anthropathy. Application in nursing. On the basis of our clinical observation, we speculate that patients with HFE hemochromatosis may benefit in their first 2 decades from constantly enhanced iron absorption, providing a stable sufficient supply of iron during psychosocial development.
CBDC here to give you 5 facts about hemochromatosis. Hemochromatosis, better known as iron overload, occurs when the body absorbs too much iron, which is bad. Over time, the iron can accumulate in the joints and in some major organs like the pancreas, liver, and heart. Fact number 1. About 70% of people who inherit an abnormal gene called HFE from each parent develop hemochromatosis. Fact number 2. If you only inherit one abnormal gene, you won't develop hemochromatosis. Pass the mutation on to your children. Fact number 3. Women are less likely to develop hemochromatosis because they lose iron due to menstruation and pregnancy. However, after menopause or a hysterectomy, their risk increases. Fact number 4. People of Celtic, British, or Scandinavian descent are more prone to hereditary hemochromatosis. Roughly 10% are carriers, and about 1% suffer from the condition. And finally, fact number 5. There are actually 3 other types of hemochromatosis: juvenile, neonatal, and secondary hemochromatosis. If you experience any of the following symptoms: fatigue, joint pain, or weakness related to hemochromatosis, CBDC can help. Visit us on the web or call us at the number below today. Thanks for checking in.
Pros and cons. Pros: they do not recommend parents to give their children iron supplements to increase their growth by the time they reach adulthood. Cons: further research has to be done on the effects of iron supplementation on high childhood different times of puberty to measure of effectiveness. Use applied in Ecuador. It is disorder of the gene orange overlap can be related to the increase in adult height in Ecuador, much not occur in this case.
With a condition called hemochromatosis. It's a genetic disorder that causes the body to store too much iron. He found it using a simple, inexpensive blood test.
You get a call saying there's some irregularities in your blood. It's a little bit alarming. But when it came out that it was something that was totally manageable, it was certainly comforting.
Hemochromatosis is managed simply by giving blood every few months. Symptoms include chronic fatigue, hair loss, and abdominal bloating. Dr. McGinnis says if hemochromatosis goes undiagnosed, it can cause severe organ damage and lead to liver disease, heart attacks, and death.
It's considered to be a relatively rare diagnosis. This has happened probably 15 years ago.
Hemocchromatosis Society is pushing the province to better educate doctors about the disorder, educate the public, and encourage more testing for hemochromatosis.
The fact is, 2 simple tests cost $35. Heart failure, liver disease, cancer is up in the hundreds of thousands. We could help save the health department of PEI a considerable amount of money in healthcare dollars.
Too much iron in the body. I know what you're thinking, Jimmy. How can too much iron be bad? Doesn't iron make you strong? Unfortunately, not always. People with hemochromatosis absorb 2 to 3 times the normal amount of iron from the food they eat. Over the years, this excess iron builds up in the body, where it can damage vital organs. Sometimes this damage is severe enough that it can even be deadly. Hemochromatosis is the most common genetic disorder in Canada, yet too often is misdiagnosed. As many as 1 in 9 people could be carriers of HHC. Let's give you an idea of how many people that is. If you were walking down the street with 180 people, as many as 20 could be carriers.
Hemochromatosis is more prevalent in the Northern European Caucasian population, but other populations are starting to become at risk as well, though much more minimal.
It is estimated that at least 1 in 300 Canadians have the genetic makeup necessary to develop HHC. That means that about 100,000 people in Canada currently have hemochromatosis. I'll bet you're wondering how this might affect your family, Jimmy. Typically, if 2 carriers have 4 children, one of these children will have both genes. 2 will each have one of the genes, and 1 will not carry either gene.
We have 2 copies of all our genes, so if the father has one gene, hemochromatosis gene, and he's a carrier, and the mother has one hemochromatosis gene and she's a carrier, then if they come together and have children, then there's a possibility that a child will inherit both abnormal copies from each parent.
So, Jimmy, I'm sure by now you're wondering how too much iron causes a problem. The average person has about 4 grams of iron circulating throughout their body. However, someone with hemochromatosis can have anywhere from 15 grams to 60 grams. Since blood can only hold so much, the excess iron is stored in other places, like organs, that are not necessarily designed to hold it.
Conclusion. A person stored is hungry, contained, open the hands he has inherited from his parents and not quickly grown during puberty. According to key health boys, an average and their grown spurt by age 16, whereas girls reach their final adult height by age 14 are